Hello and welcome. My name is Suzanne. I'm joined here with Heidi on your right, Bonnie on your left. So I'm delighted to have you here today for Release and Restore. So you only need a couple of blocks, and I'd also recommend that you have a thinnish blanket, as you might need it. And we're just going to come into a few postures that can really help with your tension in your diaphragm and your pelvic congestion. So first of all, come into hero's posture. So as you can see, I'm sat on the two blocks here. I'll turn around so you can see it a little better. So what we're aiming for when we're sat in postures is to have our knees lower than our hips. So once you've got into your posture, you can just see how that feels. You might only want one block. You might not need any blocks. You might be really flexible in the hip area. Then we'll come into seated cross-legged position. This can take a bit of maneuvering in. Again, I'm only using one block here. You might need two. You might not need any. And I sometimes like, if I'm sitting here for a while, I like a blanket over my knees. Sometimes if I know I'm going to be here, I'm going to move here, I like to pop a blanket underneath my front ankle just to give it an extra bit of padding. So it's all about getting yourself comfortable and relaxed in your posture. So take a moment just to get yourself settled in. So I'm going to come back into hero's pose for this first posture that we're going to do, but if you want to stay in seated, then stay in seated. So what we're going to do is we're just going to come into a series of postures to try and stop this roundness of the shoulders. So when we've got endometriosis, we do sometimes develop that protective curled forward posture due to pain. So I want you to get yourself settled, get yourself comfortable, like I say, in your preferred posture. Just take a moment. There's no rush. I don't want to rush you into getting into these postures because I want you to feel comfortable. And then take a moment. Maybe close the eyes. Just ease out any tension. Let the hands rest where they will. And then bring your arms up in front of you, palms facing together. Imagine you've got a block between them and you're pushing that block. Now I want you to start to move the shoulders back in space within the shoulder socket. So it's a bit like flossing your teeth. It's very, very subtle. It doesn't really look like you're doing much, but you're probably going to start to feel quite tired quite quickly. And this might be something that you've never done before. Now we're trying to just release any emotional and physical pain in the shoulder. If you need to have a break, just stop whenever you feel like you need to. Just moving those shoulders back. You might feel one's a little bit more sensitive than the other. Keep it going. Releasing tightness in the area helps to activate the parasympathetic nervous system, your rest and digest mode. Really good for endometriosis. Don't forget to breathe. Sometimes when we're doing things like this that we've never done before and repetitive things, we forget to breathe. Well done. Relax the shoulders. So to ease out the legs, let's come to stand. So you're going to want one of your blocks because we're going to put that in between our thighs. So pop that in between your thighs, and then we're just going to practice some standing, very basic standing postures, but I want you to be mindful of your posture. So take your feet hip width apart, pressing the block with your thighs. So look down at your feet, make sure they're not sticking out or sticking in, duck toes or pigeon feet. Make sure your hips are aligned with the outside of your feet. And then notice how that feels. Notice how your hip bones feel. And then just start to control your breath, breathing in and breathing out. And then move those shoulders back in space. Tilt the back of the pelvis forward and draw the front of the pelvis in. That will start to give you better alignment. Shoulders back. Now make those legs really, really sturdy. And take your concentration to your feet. So you're really pressing into your feet. Shoulders back. Pelvis is tucked. Your kneecaps are drawing up. Remember just to check your feet. Make sure everything's aligned. It might feel a bit weird because this isn't how you would normally stand. But I want you to start connecting with the shape of your body. So when I say tuck your pelvis in, how does that feel? Do you feel like you're going forward? Do you feel like you're tipping back? How does it feel in your shoulder blades? Really start to ask yourself these questions. So breathing in and breathing out. Sending that breath from the belly all the way up through the front body, creating that circulation, bringing fresh blood into the reproductive organs to reduce any cortisol levels. It's a simple posture, you're just standing here, but by pressing the feet in, tucking the tail, shoulders back, chin in neutral, breathing. This is yoga. You are now practicing yoga. Allowing that fascia tissue, the connective tissue that links your shoulders to your pelvis, to release. Releasing the tension as you breathe. Breathing in and breathing out. Listening to your body. Allowing yourself to stand tall, to encourage this pain to leave you. Undoing the tension rather than forcing. So you're not forcing yourself to stand tall. You're breathing in through your organs, through your back body, through your pelvis to release that endometrial tension. Breathing in and breathing out. So maybe just now, just take a look at that hip. Notice how it feels. Notice where it's connected to your shoulder. Check both sides. Notice how your neck feels. Push it out, push it back. Just really start to play around with the posture. Yes, you are just standing, but you're intentionally standing. So I want you to play around with the posture. Bend the knees, tilt the pelvis, move the shoulders, move the chin, move the neck. As you're doing this, release that tension from your face. So if you've maybe got a bit of a tension in your brow, maybe iron that out. Encourage a mindset of curiosity rather than correction. How does your body feel? How does it feel to be standing in this posture for this long? Okay, so grab your block and I want you to come and stand with your hands either side of your block. And then we're going to do some of those shoulder flosses again. So now we've got double whammy now. So we've got block between our legs. We've got the block between our hands. So now we're concentrating on our feet, our legs, our hips, our whole body. And then start to see if you can take that block up and above your head. Don't worry if that's far too much for you. You can play around with which side you want the block. Just want you to start getting used to that feeling of your arms up, away from you. And you're aiming to try and see if you can get them either side of your ears. But you still need to keep those shoulders down. So use your concentration, use your breath, and start from your feet and work your way up. Feet planted in, kneecaps up, tail tucked, belly in, shoulders back and down. Well done. So now we're going to come down onto our hands and knees. So take your time. You might want some padding for your knees. Tuck your toes behind you. So you want your knees under your hips. And you're going to press yourself up into down dog. So bend the knees and drop the head. So I want you to just forget about your legs for now. I want you to concentrate on your upper body. So I want you to remember how it felt when you were trying to get your arms either side of your ears when you were standing up. I want you to try and focus on that for now. So shoulders are coming back. You're pressing your fingertips into the mat. And once you're feeling comfortable with that feeling, then you can start to bring your attention to your legs. But your focus here should really be on your upper body. So your upper back, middle back, shoulders, neck. Remember to allow that head to drop. Allow that head to be heavy. And well done. Come back down onto your knees. And then from here, we're going to come into a short Shavasana. So get yourself set up. I'll move Heidi out the way. So what I want you to do is get yourself in your preferred Shavasana pose. If you don't know what that is, come onto your back and take your feet wider than the mat. Bring yourself all the way down. You might want a couple of blocks behind your knees. You might want a pillow for your head. Depending on where you are with your monthly endometriosis pain. Let's just now just relax and be mindful. So settle into stillness. Allow your body to be fully supported by the ground beneath you. Take a deep breath in, and as you exhale, feel a softening across your shoulders, your neck, and your jaw. Let go of any effort. There's nothing to fix. There's nothing to hold up. Just allow your body to unravel in its own time. Notice the gentle rise and fall of your breath. With every inhale, imagine space expanding across your chest, your ribs, your belly. And with every exhale, feel tension melt away, melting through your shoulders, out through your fingertips, dissolving into the earth. If you feel any lingering tightness, breathe into it, soften around it, and remind yourself you are safe, you are supported, you are allowed to rest. So start to deepen your breath now. Wiggle your fingers, wiggle your toes. Bring yourself back into the room that you're in, back to your yoga mat, back to the ground that you're beneath. And then bring yourself up to a seated posture. You may want a yoga block to sit on. You might want your blanket. So get yourself comfortable, bringing your hands face down on your knees, shoulders back, lengthen the neck, drop the chin slightly towards the chest to get a nice length in the back of the neck. Taking some nice big deep breaths in and out. Bringing yourself back into the now. Remember to leave this practice with that mindset of curiosity rather than correction, and ask yourself, how does your body feel? We've only done very, very slight, simple poses, but I'm hoping that you do feel some release. Thank you so much for joining me for this release and restore practice. Namaste.